Okay, got it. Now this next one here is going to be a short, but it's going to hit on the HPV again, and it's going to hit on Keytruda again. And when I was over here with our producer going through, she said, "Oh, y'all, you used these two slides 6 weeks ago."
You remembered that?
She did.
Oh, gosh, now I'm going to be in trouble. But,
all right.
I'm the one that gets in trouble.
My father is 76 years old and 7 years into treatment with Keytruda for advanced hepatocellular cancer. That means liver cancer. That came from alcoholic cirrhosis. So here we have another disease, another cancer that comes from a habit when you were 30 years younger that ends up causing a serious malignancy. So we're not going to get into that. There's 90 shots you can take for that. That says don't drink so much. He has a big spleen and low platelets. So he had cirrhosis and cancer. And he has done well, great, off alcohol and is in remission from that cancer. So the guy knows that Daddy drank too much. He's not drinking now, and he's doing well. In the
country, we call it he sobered up.
Sobered up, okay. He now has...
I no offense to anyone that writes questions.
Okay, he now has cancer in his head and neck that was unknown primary and responded to radiation therapy and Keytruda. Now, he was already on Keytruda for his alcoholic cirrhosis, for his hepatocellular, I don't know that. But Keytruda is a drug that is used in both of those cancers. He feels great. The neck mass is gone, but now some small nodes are showing up in his chest. The oncologist is reluctant to put him on chemo and suggests a biopsy. He smoked heavily for 47 years. Your suggestions, please. All right. We had this similar question about 6 or 8 weeks ago, and I said, wait a minute, those nodes in that guy's chest may be related to the COVID that he had. And that was a question about how did you go about approaching that. Remember, they were talking about an EBUS and a myostanoscopy, and Ray was talking about the tube goes here and the tube goes there. Okay, put up that first slide there. Ray has seen this in his practice, and I looked it up. In family practice or in an internal medicine practice, this isolated lymph node in the neck occurs commonly enough so that the average family doctor or internist sees at least 12 to 24 patients in his office in a year whose only complaint is, I was shaving and I have a lymph node, or my wife noted about a lymph node, or my tie didn't fit and I have a lymph node.
A couple times a month, that's good, that's right on.
Yeah, okay, so that's be 24 times a month. So here's this guy, he's got a big swelling in his neck, and this woman's got a big swelling in the neck. Pull that down. Now, we're going to tell you that big swelling in the neck, they're going to give the guy some antibiotics for a week or two. It didn't get any better, whatever. And they're going to send him to an ENT who's going to do a real thorough exam, and many times he's going to find a head and neck cancer that went to the neck. But put the next one up. We just said, what's that say right there?
Diagnosis and management of squamous cell
carcinoma of unknown primary in the head and neck. Okay.
Head and neck, yeah.
That's what this is. The guy, and he said the question said it was unknown primary. We see this all the time. This is up. This is sort of a flow chart of where you go. Pull up the next one. You got to have one of these. Got one of those?
Algorithm.
Wow, yeah, algorithm. Okay, you got PET scans and you got pan endoscopies. You got this. That check mark says primary was found, primary was not found. So by definition, primary not found. Pull that down. That means cancer of unknown primary. So now there's lymph nodes in the neck. Put the next one up. So now you got this next slide here, and it's going to show head, neck, superior mediastinum, and chest. Up here in the neck on the right-hand side, you got a lymph node. That lymph node we got radiated. You can pull that down now. But we know when they radiated that lymph node went away. Now we know that he's gone back to the doctor. They've done a scan, and he's got something in his chest. So, and it said it was in the mediastinum. So quickly put the next one up. But this just says mediastinal lymphadenopathy is associated with
The National Lung Screening
Interval,
Trial. Oh, interval lung cancer.
interval lung cancer.
Interval
Okay,
lung
pull it
cancer.
down.
Okay.
So what that tells you is, when you're treating something else and lymph nodes pop up in the chest, you got to go look that didn't represent a new lung cancer, that it's not particularly related to the problem that you have. And the guy gave us a hint, didn't he? He smoked heavily for 47 years. So radiating this head and neck cancer took care of it. The Keytruda has taken care of his cancer in the liver or whatever, and now there are nodes in the chest. Well, they could be COVID nodes if the guys, because this new variant, people aren't even sick. It could be nodes from the head and neck cancer, which would look in the microscope just like the ones from the head and neck biopsy. It could be a new lung cancer. The best thing it could be would be COVID lymph nodes. It could be lymphoma. In other words, it could be lots of different things. So you remember this slide from a few weeks ago? You remember all those numbers on here? You got the next one up there? So these things have Latin names. That right there is your breathing tube. That's what goes out in the lungs. That's your heart. That's all those big blood vessels. They've all got names. Pull the next one up there. But every one of these little areas has got a number, right? There are 12 numbers here. When you get to the 12 numbers, then they're all divided out. Remember, mediastinoscopy versus EBUS. Pull that down. And Ray explained about the mediastinoscopy and EBUS last time. So the question is, the oncologist is reluctant to put him on chemo. Well, I wouldn't put him on chemo either. If this is related to the head and neck cancer, yes, you put him on chemo for the head and neck cancer. But if it's a new lung cancer, you got to do genetic testing.
Yeah, tissue and genetics.
If it's COVID lymph nodes or lymphoma, it's not going to. So anyway, they got to go do the biopsy and leave the guy alone. He's getting great care. I'll stop right there.